Today we are reporting as well on the COVID-19 for 3 reporting periods. From Friday to Saturday, we had 86 new cases diagnosed. From Saturday to Sunday, 107 new cases, and from Sunday to today, 101 new cases, bringing our total to 294 new people diagnosed with COVID-19, including 3 epidemiologically linked cases over the last weekend. That brings our total here in British Columbia to 5,790 people. That includes 1,900 people in the Vancouver Coastal Health Region, 3,042 people in the Fraser Health Region, 175 people in the Vancouver Island Health Region, 440 people in the Interior Health Region, and 154 people in Northern Health Region. 79 of our cases have been people who reside outside of Canada. We currently have just over 1,107 active cases in the province in all of our health authorities, of whom we have 28 people now in hospital, 10 of whom are in critical care or ICU. In the past weekend, we have had 4 new people who have died from COVID-19, 3 of whom were residents of long-term care. And our condolences go out to the families, to the friends, and to the care providers for these people. We have 2,723 people now under active public health monitoring because they have been a close contact of a case, and we're now up to 4,406 people who have recovered from COVID-19. In terms of outbreaks, we have 1 new healthcare outbreak in the Normanna long-term care home in Fraser Health, where we have a single healthcare worker identified with that. And we have 2 outbreaks that have been declared over. One is the Dania home outbreak in Fraser Health, and the other, thankfully, is the Holy Family Hospital outbreak in Vancouver Coastal Health, which was, as we know, a very challenging outbreak. And we are all very relieved that this has been brought under control. There are 10 active outbreaks in our health system, 8 in long-term care and assisted living, and 2 in acute care. And we're now up to 725 cases associated with those, 440 residents and 285 staff. We have no new community outbreaks, although we do have a community alert for the Presbyterian region that Northern Health has put out with a number of cases associated with events that have happened in the month of August. So anyone who attended events, gatherings, or ceremonies during this period is asked to monitor themselves closely for symptoms and to contact public health. We have testing available rapidly in the area for anyone should symptoms develop. On a positive note, the Kelowna area cluster that started after the long weekend in July has now been officially declared over, as we've had no new cases associated with that over the last few weeks. On Friday as well, we announced that the Haida Gwaii outbreak has also been declared over, and it really is the communities coming together and working together to manage these clusters and these outbreaks that has made a tremendous difference in making sure that we can bring them under control as quickly as possible. So as we are looking now to the fall, tomorrow is the 1st of September. We are entering a new phase of our BC COVID-19 pandemic. The increase in the number of new cases that we have seen over the past few weeks remains a concern for all of us, and we all have to do our part to ensure community spread remains low and that we are actively supporting public health teams to quickly manage these new cases so we can contain the spread and find that balance that we need. After many months of restrictions, we all needed to reconnect with our family, with friends, with our communities this summer. We traveled, we enjoyed our province, and many of us recharged. Now we must slow down on our social interactions, and we must prepare for the respiratory season ahead. We've talked many times about the fact that we will likely have a second wave. We've seen a surge in cases, but we've managed to keep our curve flat and we need to continue to do that work as we move into our respiratory season. To be successful in this next phase, we need to step back to allow us to safely move forward in this pandemic. And I need everyone to pay attention. As the cooler weather arrives, we all have to be ready. We have seen the challenges that this virus, COVID-19, has to prepare. As we step into our offices, our workplaces, our schools, we need to take a step back from some of the social interactions that we have had this summer. Being ready means all of us getting back to the basics that we know takes to control this outbreak. So that means going back to our layers of protection and our personal COVID-19 safety plans for us and our families. It means washing our hands regularly, keeping our groups small, giving others the space to stay safe, particularly in uncontrolled environments, and sometimes that means wearing a mask as well. Particularly when we're around people that we don't know, and avoiding those face-to-face contacts. It means always, always, always staying home if we're ill. If you have elderly relatives that you live with, or you spend time with, or you care for, you may want to spend less time with other contacts, with other friends. If you live in a small apartment, then large parties with even 10 or 15 people is not safe for you or for your guests. We need to rethink gatherings, particularly ones that we're going to have indoors. As the weather changes and we move towards more indoors, we need to keep our visitors to a minimum. And we need to think about the restrictions that we have in place, for example, at restaurants, where small numbers, 6, for example, or the restrictions that we have in place in our short-term rental properties with a maximum of 5 visitors. Those are the guidance that we need to use in our own personal settings right now to make sure that we can continue to do the important things we need in our communities, which means going to work, which many of us have been doing for some time, but more people will be doing in the coming weeks. Staying home when you are ill is one of the most important things all of us need to keep doing. It can be difficult to tell the difference between a cold and allergies and influenza and COVID-19, and as a result, the first step for everyone is to stay home if we're not 100% healthy. And that is a challenging thing, I know that. But the bar to stay home needs to be lower than we have ever had it before, for us and for everyone in our family. Our superheroes now are not the people who put aside our illness and go to work, but the people who protect our colleagues and our communities by staying away until we're healthy again. I ask employers, caregivers, and parents to think ahead and to prepare for the coming weeks and those days when an employee or your child is feeling unwell, and make a plan for how you will manage that. And employers, this is a time we need to continue to be flexible, to ensure that we're giving employees what they need to stay home, to work from home if need be, without recrimination or financial harm. No one knows for sure what the fall is going to bring. We may see a surge. We may see a surge in influenza. We all need to be prepared now for whatever challenge may emerge. To ensure we can continue to protect our most vulnerable, the people that we know are more likely to have severe illness with this disease, to protect our healthcare system, to make sure that we can continue to have those surgeries, that we can continue to have visits in our long-term care homes. These more challenging, colder months, we have to close those gaps that we have had here in the summer and flatten our curve again. COVID-19 requires new thinking, new routines, but following our proven layers of protection will keep us all safe. Our goals for BC are clear. We need to prevent cases through our renewed personal safety plans. We need to pay attention to how we are feeling every day so that we can detect new cases as quickly as possible. And we need to support our public health teams that have been and will continue to be there for all of us over the next few months or years, as long as it takes, to quickly contain the spread of this virus. We know that is working, and we know that's what we need to do to keep us safe. So let's start today to find our new balance. Let's start September knowing we are united in our singular focus to keep going, to keep our communities going, to keep our elders, our seniors, and our families and ourselves safe every single day. And let's also continue to do this by being kind, being calm, and being safe. Thank you.